Hello, I'm Alice Sparksman. I'm a local services manager for Alzheimer's Society in Norfolk and Waveney. And today we're going to be looking at the topic of what is dementia and can a diagnosis help? So if we first look at the aims of the session, and the session aims are to gain a greater understanding of dementia and to help better understand how dementia can affect people and why getting a diagnosis can help people affected by dementia. So if we look first at the prevalence of dementia, there are over 900,000 people living with dementia in the UK, and this is expected to rise to over 1 million by 2025. Every 3 minutes, someone in the UK develops dementia. 1 in 6 people over the age of 80 have dementia, and over 42,000 people in the UK are living with young onset dementia, and that is those people below the age of 65 with a diagnosis. There are more than 25,000 people from Black, Asian and minority ethnic groups in the UK who are affected by dementia, and there is currently no treatment to prevent or cure dementia. So what is dementia? We know that dementia is an umbrella term and it's used to describe a set of symptoms. And dementia is caused when the brain is damaged by disease such as Alzheimer's disease, vascular disease and Lewy body disease. And we can also note that there are over 100 types of dementia. So we first look at the 4 most common types of dementia. And the most common type of dementia is Alzheimer's disease, followed by vascular dementia, and also dementia with Lewy bodies and frontotemporal dementia. What we'll do next is have a look at some of the symptoms. So with the symptoms of Alzheimer's disease, people often struggle with losing items such as keys. They might struggle to find the right word in a conversation. They might forget somebody's name, or they might use a different word for an object. So for example, they might call a dog a horse, or use words in a different way round. Somebody may get lost in a familiar place or on a familiar journey. They may forget appointments or anniversaries. People often find that they have very much struggle with a short-term memory loss, so they may forget what they'd had for breakfast that morning or an appointment that's coming up, but they can remember things from a long time ago. People can struggle to follow a conversation or start to repeat themselves. People can become confused and lose track of the time of day or the date. They may struggle at certain times of the day. Navigating stairs or parking the car may become much harder. People often struggle with perception, so they see things in a different way because of how the brain is affected. And there'll be difficulty in concentrating, planning or organising, often with planning ahead. So vascular dementia, if we look at some of the symptoms of vascular dementia, again, problems with planning, organising and making decisions. People can struggle to concentrate and the speed of thought can become much slower. People might find it hard to focus on words, and language and speech may become less fluent. Some people really struggle to communicate verbally quite quickly. And there can be problems perceiving objects in 3D, so people may struggle to identify objects. So dementia with Lewy bodies, if we look at some of the symptoms, again, people can struggle and have difficulty in judging distances and also seeing objects in 3D. There may be a fluctuation in alertness and speech and attention throughout the day. A fairly common symptom for people with dementia with Lewy bodies are visual hallucinations, and people will often see people or animals. Also auditory hallucinations, so people may hear sounds that are not real, such as knocking or footsteps, and believe that people are nearby. Frontotemporal dementia. So people with frontotemporal dementia may show some repetitive, compulsive or ritualised behaviours. People can often lose interest in people and things, activities, become quite apathetic and commonly lose inhibitions. So people can behave in a socially inappropriate way, physically, verbally, or act in an impulsive or rash manner where they would not have done so prior to the diagnosis. Well, with this slide, we're looking at words that we like to avoid when talking with people affected by dementia or talking about people living with dementia. And what we often ask people is, what is the first word that comes into your head when you hear the word dementia? And some of these words will come up. So we have dementia sufferer or demented, senile or senile dementia. A burden, so people are a burden or they'll cause a burden to others. A victim. We also have a plague or an epidemic to describe dementia. Enemy of humanity and living death. So, for example, dementia is a living death. And all of these are very negative words and will increase the stigma around talking about dementia. So if we look at some positive ways to talk about people living with dementia, we prefer to use some of these examples. So a person or people with dementia, the person or people living with dementia, and also a person or people living well with dementia. So why get a diagnosis of dementia? So if we look now at the importance of early assessment and diagnosis for dementia. Gaining access to information, resources and support for a person after a diagnosis is so important. Those early interventions are beneficial in improving cognition and helping sustaining self-esteem and to treat depression. This can maximise the quality of life for people who have a diagnosis, and this is at any stage. So if somebody is diagnosed at an early stage, those early interventions can really help, but also for somebody who may be at a later stage in the dementia, it can be so important to get a diagnosis for those supporting that person, carers, family, to understand what is happening with the person and how best to support them. There are certain treatments that can help with those dementia type symptoms and can help in reducing severity of the symptoms, so alleviating symptoms for people. So gaining access to those treatments can be so important, again improving quality of life and health. The awareness of the progressive nature of the disease allows family and caregivers to plan ahead, prepare for situations that may be challenging and gain further support. And in planning for the future, allowing the person to make their own choices about treatment and financial planning. So this may be by way of the person setting up a lasting power of attorney, so they may have help and assistance in the future. It may be the person would like to look at some advanced care planning, an advanced statement or directive, wanting others to know their wishes and what support they may need in the future to help them live well now, but also to plan for the future. And living well means different things to different people, but with the knowledge of the diagnosis, the increased help and support can really help the person to live well for longer. So now we're going to look at a short video about Bill and Joe. This is Bill's story of what happened after he had a diagnosis of dementia.
Who am I?
Who are you?
Yeah.
Bill
Bill what?
Wilson.
And you are Joe Wilson. And we've been together for 50 years almost. And married for nearly 42.
He's dreaming again.
I stopped working early. Joe and I decided that we wanted to spend more time together, and I'm really, really pleased that we did that now. Had I left it until I retired, it would have been too late. Maybe I didn't want to think about the changes that I was seeing. Deep down inside, I really knew what was happening. The good thing about this life, and the good thing about getting a diagnosis early, is that you can have a new life together. That life has ended, you know, and a new life has begun. And a really interesting thing that I've learned is that we can become acquainted with one another anew every single day. Words don't mean very much now, but feelings mean so much and tone of voice means so much. Jo has such a strong will and a strong personality, haven't you? That shines through all the time. You just have to dig a little bit deeper sometimes. Now, who's this handsome young slim man?
Not you.
You look gorgeous, don't you? You always do, always did,
What?
always will. Look gorgeous. Well, I think so. She's fighting this disease in her own way. And I'm more proud of her now than I have ever been. It's my privilege to help Jo with that journey. Because we love each other so much. I love you with all my heart and soul, don't I?
Our question from providers for this session is diagnosis always helpful, especially when there are cases where a late diagnosis is given?
Yeah, I think a diagnosis can always be helpful. It may be a late diagnosis, so somebody may be living with other health conditions, may be at a very much later stage in the dementia, but finding out about that diagnosis, there may be treatment possible, medications, but it's looking at other ways to support that person specifically around that dementia diagnosis and those specific symptoms which may be affecting that person which weren't known prior to the diagnosis. So it may be just providing support and comfort around why somebody might be behaving in a particular way. For example, if somebody is struggling and becoming frustrated, this may be shown in agitation, some aggression, but actually, if it's due to a dementia diagnosis, that information, that knowledge for caregivers, for family, can be so important to help with understanding and finding ways to support that person to enable them to find ways for comfort and support themselves so that they, to help with those types of behaviours.
Thank you for watching. If you would like more information, please visit norfolk-and-suffolk-caresupport.co.uk, where you'll find further training on our learning portal. The link for this website is in the description down below.